We're going to be talking a little bit about applied behavior analysis, ABA, which did come up, through some of our recommendations. And we're going to talk a little bit about what that means, and then also some of the ways that a family might access those services. Next slide. So just to give a little bit of background of, what ABA is. So I think this is a term that families hear often, and this is often, recommended by clinicians or through evaluations that families have. And it's not always clear, exactly what that should look like and what that means when we're saying ABA. So ABA has actually been around for many decades, but recently I think it's become more of a familiar term as, families have become more aware and the demand for these services has really increased. And families have actually played a really large role in a lot of this in helping to promote advocacy to increase access for services. So, for example, in our area in Pennsylvania and New Jersey, both, it was through efforts of, parents advocating that these services now are available for families who have medical assistance or Medicaid, where previously it was a lot harder to access services if you didn't have commercial or private insurance. But along with this sort of increase in demand and attention about ABA has also led to some misunderstandings and misinformation, and also, some autistic adult self-advocates kind of speaking out about experiences they had as children that maybe weren't really in line with what we know today our goals of ABA should be. So we want to just kind of go over a little bit today about, what we are talking about today when we suggest ABA services for a family and for a child, and, how we really, we want to provide good evidence-based information so families can make decisions about the services that are going to be the right fit for their family. ABA does have a solid base of research supporting the effectiveness in terms of strategies for building and promoting skills and reducing some of those behaviors that could potentially be dangerous for children and individuals with autism. And there's been research, looking into ABA and published in journals for many, many years at this point. Next. So when we talk about ABA and we're kind of saying, what is this and what does this mean? So ABA really is a set of principles upon which these interventions are based. So it's not one single program or one single way of interacting with a child or an individual with autism, but it's a really kind of individualized program based on these principles. And there's lots of different kind of terms on this slide that could be related to an ABA program. But I think some of the important things to take away are this idea that this should be very individualized to your child or to the individual that we're providing this service for. And this should involve a lot of positive reinforcement. So, we are wanting to really encourage and teach skills that are going to help somebody access all of the things they want to access. So really the basis of using ABA is to help provide autistic children and individuals with the tools they need so that they can, be involved and engaged in whatever activities they want to be involved and engaged in. And so this may involve things like taking more complicated skills and sort of breaking them down into smaller parts. Like Judy mentioned, sometimes for our autistic children, it may take a little longer for them to be able to learn and understand the rules for a game or for a certain activity. And so sometimes being able to teach those skills in smaller parts is really effective. This also is really, ABA is based on the idea that all sort of learning that we all do, not just individuals with autism, is based on this idea of things that happen before we do something and things that happen after. And this is how we all learn sort of what is expected of us. And ABA is really based on sort of natural behavior principles that we all are using every day. So most of the things we do are behaviors that have a certain purpose and a certain function. We all learn, I'm going to take a shower every day because I've learned that if I don't, I'm going to be dirty and people might not want to be near me and I might, not feel good and I might end up getting sick. And so these are behaviors that are learned naturally for many individuals because they have a purpose and they serve a function. But for certain skills, children with autism really benefit from a more kind of structured approach to learning some of those things. You can go to the next slide. So this, again, this idea of sort of learning and shaping behaviors is based on some, kind of basic behavioral principles that we use every day. So there's an antecedent. So that's kind of whatever happens before a behavior. And when we say behavior, that doesn't mean just a negative thing. This is actually, ABA is also really focused on teaching and building positive skills. But the antecedent is whatever happens before. And then the behavior is the observable thing that somebody does. And then consequence also doesn't mean a negative thing necessarily. It's just whatever happens after the behavior. So for example, if we have a child in school who's maybe being given an assignment or a worksheet, and the antecedent is that the teacher's handing out this work. And if this is something that a child really doesn't enjoy or they're frustrated by, we might see a behavior of them ripping up their paper. That's the behavior. And then the way that the teacher responds after is the consequence. So if the teacher responds by saying, oh, okay, you don't have to do this work, that's now taught and reinforced that this behavior works. And when I rip up a paper, I get to stop doing the thing I don't like. And so when we want to shape new behaviors, we're going to respond in a different way, where maybe the teacher instead is going to give some choices and say, I can see like this isn't something you want to do right now. So let's choose. Here's 2 other activities. You pick which one you want to do. And so in this is a very simple example of one way that we might be thinking about these strategies in terms of encouraging new positive behaviors and not reinforcing those negative behaviors that we want to try to get away from. Go ahead. So when we hear about ABA, I think this is where some of this sort of misinformation has come out over the years. ABA is not just a table and chair therapy. So historically, there were a lot of ABA programs that looked very much like that, where a child is seated at a table with an instructor and there's very little sort of stimulation or interaction happening other than direct teaching of skills. So this is something that, there have been ABA programs that look like that. But today, when we talk about ABA, this is really not what we mean for most of the children that we're working with. ABA is a tool. And so again, it can be misused. So when we're looking for an ABA program or an ABA provider, this is a very individualized process. And so finding a team that's really a good fit for your family and for your child is going to be equally important, as getting the service itself. So ABA is not only the low-VOS method. And this is, again, kind of reflecting back to the table and chair idea. So historically, ABA often involved what we would call discrete trials. And this was sort of part of the origins of using ABA. And this was a very, again, direct sort of rote teaching method. There are places where this is still effective in small amounts for certain individuals, but today we have so many other ways of using ABA, and a good program, which we'll talk about later, should really be incorporating lots of different strategies and not having a child sitting at a table, for hours on end. Also, it's not a program that just reinforces with M&Ms or food. So really the basis of changing and shaping any behavior is that we want it to be motivating. So in some ABA programs, when we're first starting out, food or rewards may be used in that way to really get a child engaged and excited and enjoying what they're doing. But the bottom line is that we're wanting to provide reinforcement and motivation. And so that's going to be really based on someone's individual interests. And a good program should be built around that child or that individual and what they like to do and how we can continue to sort of build on those skills. And the ABA is not just for difficult behavior. So today's case, the little boy that we're talking about, that's the primary concern right now because it's a safety issue. And so ABA is a potential approach to help sort of reduce some of those problematic or dangerous behaviors. So it certainly can be used that way. But a good ABA program is also then building and teaching a lot of proactive and pro-social skills. So in addition to helping to reduce his behaviors, we're going to have to be teaching him the positive skills he can use to still get things that he wants and to still have the outcome that he wants, but in a safer way. And once again, just want to kind of emphasize that ABA is not any one specific program. There are ABA-based programs, but that can vary quite a bit. So this is just sort of illustrating that ABA-based interventions are also kind of on a spectrum. So we do, historically have these very structured teacher-led sort of discrete trial methods to ABA, which again have, some place still in smaller parts of programs, but most of what we want to see now is a more naturalistic, play-based, and child-led approach. And so when you're watching an ABA session that's really naturalistic, it should look like play. And it should look like this child is enjoying what they're doing and they're engaged with their therapist and they're working on things that are fun and motivating. And within that, the therapist is building in skills and is helping to shape behavior, but it shouldn't look as obvious as sort of our historic discrete trial teaching methods. Go ahead. So when we want to use ABA, lots of different scenarios can be helpful. So again, this is a strategy to help reduce that problematic or dangerous behavior, but really it's also used to help teach language and communication. Can be used particularly for older adolescents and teens moving into adulthood to help increase independent living skills and really build and teach those adaptive skills. Teaching academics. So sometimes if there's an area that's particularly challenging, this is a way to help break down some of those skills and use this as a more direct teaching method. And to help reduce anxiety or fears. So again, shaping behaviors and helping to slowly teach these skills in a safe and motivating setting. So it can really be used in lots of these different areas, not just sort of in the way that we think of reducing the tantrum behavior, although that can be a big part of a program. We're really looking at building all of these other skills as well. And where is ABA delivered? So this can really be anywhere, and it varies quite a bit. So when we're talking about a formal ABA program working with a team, these programs can be home-based. And so specifically with our case today, we would want to probably think about providing some services in the home. So this family might benefit from some support in, creating some of the routines and structures that we talked about, having a specialist really be able to see the tantrum behavior and help identify some of those antecedents. So what were some of the things that are happening before the behavior? How can we help change, and motivate, make this setting motivating for the child? A lot of ABA services also happen in a clinic. And so this can be really helpful in preparing kids to start school or helping to build some of the group-based skills. So they may go to an ABA center where they're working on some things individually, but also incorporating some of the social skills and working and interacting with other kids. School-based ABA programs also exist. So this may look a little different, but a lot of autistic support classrooms are going to be based around ABA strategies, and those are going to be some of the methods that teachers are using in those classrooms. And then combinations of these. So again, with this little guy that we're talking about today, he may start with some home-based services, and then it would be really helpful if his team could also see him when he starts school and see sort of what his skills look like there, so they can help generalize those skills across all of those settings and help all the people working with him be really consistent and clear. And in terms of intensity and duration, historically, we would hear about programs of ABA being upwards of 40 hours a week, but today really the most common average is about 15 to 20 hours. But this also is based on sort of individual need and the areas that we're working on in an ABA program. And so who can practice ABA? There are many different providers that may be working as part of a program, but in general, we want to look for a board certified behavior analyst to be leading the team. So these are individuals who really have very specific training in this area and complete field work and have licensing. And so this is often the person who will kind of supervise and oversee a good ABA program. Registered behavior technicians, RBTs, this is also a sort of certification process. And these are often the providers who are working most directly one-on-one with the child and with the family. So working off of the plan and the goals that are developed with the BCBA and supervised with the BCBA. There are some other roles that we might find within an ABA program as well, but most, if not all, states have some sort of guidelines and licensing around ABA providers and sort of the different backgrounds that they need to have to provide this service. So how to get ABA? There are different ways to access this service. So through insurance, and Pennsylvania, New Jersey, and actually I think all states at this point have some type of autism mandate. So if you have commercial or private insurance through your employer, they are going to be mandated to offer some sort of funding for autism-specific services. Now, there are some areas where this won't apply. So for example, if you are self-employed and you purchase insurance through the marketplace, they will not be bound necessarily by these same policies and guidelines. So this is something where you'll really need to get information about your individual plan. Schools are a place, so this can be through early intervention or once a child starts in public school, having either an ABA-based program or even getting some direct ABA support if that's needed within the school setting. And then medical assistance for Pennsylvania. So this is a type of insurance, which many of our Pennsylvania families will have as either a supplemental or primary insurance, but this is going to be Pennsylvania specific. There is a service called Intensive Behavioral Health Service / ABA, which is offered through the state of Pennsylvania for families that qualify for that. And then private pay. So up until a few years ago, with some of the great advocacy work that families did, many families were stuck with really high bills trying to pay for services because they weren't able to access some of these licensed providers. So that's a way that we really want to try to avoid. We want to help families to really understand how to use the insurance they have and the systems that are in place to access these services. Have this little note here that probably many of you on this call are already familiar with, but even with these funding sources, there is a shortage of providers. And so part of our goal in offering some of the strategies and the knowledge burst that we have here through ECHO is that we know there are families who are waiting to get these services and who have done all the right things and just are waiting to have a provider available to work with them. And so in the meantime, we want to offer some of these suggestions and strategies so that families have things they can be working on while we're waiting. So if you have commercial or private insurance and you're going to look into how to access ABA through that, the best place to start is to call directly and talk to one of the care coordinators with your insurance company. And many plans actually have an autism-specific care coordinator at this point. And what's important here is to get very specific details about how the autism benefit for your insurance plan works. So are there going to be copays associated? Are there deductibles associated? Is there a limit on the number of sessions? And this is really important because if you start services and your child maybe is going to an ABA center 3 days a week, if you're having to pay a copay every time, that can add up quite quickly. So it's really important for families to have a good understanding of what that's going to look like and how they're going to be expected to cover, any portion that's not covered through insurance. And then we're going to want to find a list of in-network providers for ABA. So just like any kind of specialty care that you might be getting through your health insurance, we're going to want to start with in-network providers to make sure that you're going to get full coverage for these services. And given today's sort of climate and the lack of providers, I think it's also important to call several places and try to get on the list for an intake with more than one agency so that hopefully as soon as somebody has an opening and can start to work with your child, you'll be ready to have those services begin. So in Pennsylvania only, if you have medical assistance as your sort of supplemental or even primary insurance, each county in Pennsylvania is going to have a behavioral health managed care organization. So similar to calling, with your private insurance, here you're going to call your county managed care office and ask for a care coordinator. And the service here is going to be IBHS/ABA. So these are ABA-based services, but they're through this intensive behavioral health service that is funded through Pennsylvania Medical Assistance. So it's going to be a similar process, but the list of available providers might be a little different. And the other really important thing here is that for medical assistance, you have to have something called a written order provided by one of your medical care team members. And this is basically like a prescription for ABA. So there are some specific forms depending on the managed care organization that are going to ask a provider to basically say, yes, we are suggesting or recommending ABA service for this child, and here's how many hours we think would be beneficial, and here's if there's any other services that we think would be beneficial. And the written order is also going to provide some documentation of this confirmed autism diagnosis, because right now, in almost every case, a child or individual has to have an autism diagnosis to access ABA through insurance. And then the same thing, once you've got that information and you've got your written order, going to go through that list of in-network providers and try to, call and see where you can get an intake and start the process for accessing services. A really important note here for Pennsylvania families only, if you have commercial insurance and medical assistance as your secondary insurance, when you get those in-network provider lists, you need to find a provider that's listed on both. So what will happen is that your commercial insurance will typically get billed first. And then the benefit of having medical assistance is that any of those copays and other costs that would have been there will be picked up by medical assistance. But you do have to find a provider that's able to bill both of those different types of insurance. So just to give a little bit of background on what IBHS is, because this can be really confusing. So this really has replaced what we formerly called wraparound. So many families and providers are familiar with this term wraparounds, which was often a one-to-one based behavior support service. But what we were finding is that sometimes our children with autism were being paired with teams who really didn't have the right background and the right training to understand the kinds of interventions that would work well for them. And so this was leading to some different sort of health inequities in terms of access to good services. And so with these recent changes with insurance access, we've moved into this new type of service called IBHS ABA. And these titles at the bottom are just so if you see these terms, you'll be a little bit familiar. This is the name that they give to some of the different team members that might be involved in the IBHS team. But essentially, you're going to have a sort of supervisor or team leader who, again, should be somebody with a board certified behavior analyst or a licensed behavior specialist, and they're going to be the one that helps develop the plan with the family. And then you're going to have the behavior technician here is what we would look at rather than that registered behavior technician. So these are going to be the people really working directly and helping to implement some of the strategies. And then IBHS also includes another component, which is not going to be typically through a traditional private ABA provider. This is mobile therapy. So this might be suggested also, and this is sort of more like a traditional outpatient therapy, but somebody who's going to actually come to the home and really work on some of the more social and emotional processing needs. So when we're thinking about a good ABA program, these are some of the things we really want to keep in mind. Number one, this should be motivating and interesting for this child or individual. So they should be, happy when they see their ABA therapist come. They should be enjoying what they're doing. They should feel motivated by what's happening. And a good program should be really using a combination of these different kinds of strategies and approaches that we've talked about based on what the need of this individual is. So there may be some components of more formal teaching, but also there should be a lot of naturalistic environment learning. And as we talked about a lot today, working on some of those daily routines. So ABA is a way to help support that and support teaching all of those basic daily routines, daily living skills, so that somebody can start to be as independent as possible and really have some structure and routine around their day. These good programs should promote generalization and spontaneity, meaning that these are going to be skills that we want to start to see this child or individual be able to use in lots of different settings and lots of different ways. And a good ABA program should directly involve parents in planning. So whatever, the family's priorities should be sort of the basis for developing the ABA program. And having them be actively involved in understanding everything that's being worked on and getting strategies and skills that they can use on their own. So now I think we have